Hi, I'm Danielle. Today we're going to be doing Foley catheter insertion. First thing I'm going to do is verify my orders. So I do have an order for this patient here. We're going to do a catheter insertion. So I've gathered all my supplies. I've checked to make sure the packaging integrity is all good. Expiration dates have not passed. So now I'm going to go into my patient's room. Hi, I'm Danielle. I'm going to be your nurse today. First thing I'm going to do is hand hygiene. All right, can you verify your name and date of birth for me?
Sure, it's Perry Potter 2/10/1955.
All right, Miss Potter, do you have any allergies?
To latex?
All right, well, we do have a catheter here. It's not latex, so we are all good there. I'm going to be doing a catheter insertion for you today. It is a sterile procedure, so I'll ask you to help me out with a few things and then have you be kind of still for the rest of it. Mind if I turn the lights on here?
That would be great.
All right, can I use your bed for my stuff?
Sure.
All right, I'm going to do this here. I'm going to grab a pair of gloves. Just going to clean up a little bit so that I can get my stuff together, and then I'll be out as soon as I can.
Make sure that I secure.
Grab one of these. Wipe off the table. All right. I'm going to move the table up to waist height so I have a good working surface. Now remove my gloves. I'm going to perform hand hygiene again. And Miss Potter, is it okay if I raise your bed so that I can do the procedure?
Sure.
All right.
Now that I am no longer needing the secure area.
Raise the bed up to waist height. I'm on this side because I'm right-handed, so I'll need my dominant hand for the procedure. Did you want some privacy?
Yes, please.
All right, I'm gonna close this. I'm gonna grab some gloves here. All right, I'm just gonna place a waterproof pad under you. So we're placing the pad underneath. This patient does already have one. All right, next thing I'm gonna do here is I'm just gonna get you into position so that it's easier for me. So I'm gonna pull the sheet down. All right, that's all good. I'm gonna pull your gown up. I'm gonna pull the legs out into position. Patient can assist with this if able. All right, Perry, I'm gonna have you wipe off your perineal area with this warm washcloth with soapy water. So patients can wipe off the area. And then we're gonna set this down here. Next thing I'm gonna do is get my supplies. Gonna grab this here, gonna open it up and set it in between the patient's legs. And I'm going to go ahead and open away from myself. Everything is sterile. I do have a 1-inch border. All right, and the next thing I'm going to do is grab the pad and put that underneath the patient. Just gonna take this out here. 1-inch border. And I'm going to place the shiny side down under the patient. All right, so you've got that under the patient. Next thing I'm going to do is put on my sterile gloves. So I'm going to dispose of these, perform hand hygiene, make sure my hands get all dry so I can get the gloves on.
I mean, I definitely got it.
And I'm gonna grab this package here and open my gloves.
Yeah. Because I think if I screw up skills, I'll just be like kind of.
And put it in this hand first.
Should you ask your permission?
And go underneath. This hand, perfect. And I can adjust now because I am sterile. I'm gonna put this package over here. And then since we are using a female here, we have a female, I do not need this drape. It is not 100% necessary, so I'm just gonna move it to the side. Next thing I'm going to do is I'm going to open up my swabs. So I've got my swabs here that I'm going to clean the patient with. And the next thing I'm going to do is open up my lubricant. So you would open up this lubricant and then put it in this tray here. But for today's purposes, we are just going to use this. So I'm just gonna do a little squirty squirt in there for that. And then I'm going to pull out my catheter. So I've got all this here. Just gonna kind of leave this coiled up, and I'm going to pull this down a little bit so that I can attach my syringe. And then I'm just gonna leave this in the box here. Attaching the syringe. Great, that's ready for me. And then the next thing I'm going to do is just remove this packaging here so it's ready for me as soon as I am ready to insert. So that goes here, and I'm just gonna place this right here back in the box because it is sterile. Next thing I'm going to do is grab my swabs. And I'm gonna let Miss Potter know. All right, Miss Potter, I'm gonna go ahead and clean the area now so that we can get started with your catheter. I'm gonna take one. I'm going to spread the labia. As soon as I do, this hand will not be sterile. So we're spreading, and I'm gonna do the one that's the side that's away from me, going top to bottom. So we've got that one. And then I'm just gonna pour the other two swabs out here. Grab another one. We're gonna do this side, top to bottom, and then we're gonna do the middle, top to bottom. All right, and then we're just gonna grab the catheter here, get it lubricated, dip it in your lubricant, and then we're going to insert into the urethra. So we're inserting until we see urine return. So if I would see urine return now, I do. I would go ahead and advance another inch or two, and then I would hold the catheter and inflate my balloon. And then as soon as I've got all of my solution in, I'm going to disconnect here, and I'm going to tug until I feel a little resistance. So we've got resistance there, and everything seems to be all good. So next thing I'm going to do is attach the bag to the bed. So we are attaching here to a non-movable surface of the bed. So we've got it attached down here, attached to the patient's leg. So we're gonna go around the leg, attach. All right, so we're going to turn it so that we have this here. Pull this out, and we're gonna just adjust a little bit. Just want to make sure there's some slack in here so that it's not uncomfortable for the patient. And then attach here, and there's some slack, and we're all good. Next thing I'm going to do is dispose of everything. So I'm going to just kind of grab everything, put it all together. And everything is not sterile anymore. So we have grabbed everything. We are throwing it in the trash along with my sterile gloves. So today we're going to go ahead. Next thing I'm going to do is perform hand hygiene. All right, Perry, you are all good with your catheter. You can go ahead and put your legs down, and I will assist you.
Do you want me to redo it?
I'm going to grab a new pair of gloves just to help the patient. All right, patient back into a comfortable position. Gown is down for privacy. Move that out of the way, and then pull this back up. All right, and if I needed to, I would go ahead and grab a sterile specimen if needed from the urine output. We don't have an order for that today. All right, Perry, I'm going to go ahead and lower your bed back down. Would you like your lights on or off?
On is fine.
All right, so we'll keep the lights on. My bed is locked. This side rail is up. This one is down. The patient doesn't need it up. And would you like your curtain open or closed?
Open's good.
Okay, so we're going to open the curtain. And last thing I'm going to do is clean my table.
my name is Shelby.
Perform hand hygiene. And then I'm going to document that I inserted the catheter and if needed the intake and output. And then I am done.